Hello and welcome to Everyday Oral Surgery. This is your host, Dr. Grant Stucki. I am an oral and maxillofacial surgeon practicing in Denver, Colorado. The goal of this podcast is to connect, learn, and inspire. In this podcast, you'll be hearing from OMS surgeons all over the globe discussing ways to improve the practice of oral and maxillofacial surgery. Most information shared in this podcast will be based on personal experience and opinions, so please supplement what you learn here with approved research studies. Without further ado, please enjoy today's episode. All right, welcome to another episode. Today I'm with Dr. Roger Levin. He is been on the podcast multiple times, but is the founder and CEO of Levin Group. Such a fantastic group trying their best to help practices expand and grow and do better in all aspects of practicing. So Roger, great to have you on the podcast again.
Oh, Grant, I'm thrilled to be back, and I think that we're reaching a lot of people with ideas for them to think about, and that's just powerful. And today is part two from our last podcast on the title "Why Your Referral Marketing Can Fail." Now, having said that, I'll remind everybody I'm a extremely positive thinker, and I'd like to be practical and helpful. But referral marketing can fail, and it's so important to understand why and maybe avoid some of the pitfalls that I'm going to talk about today. So I'm thrilled to be with you. I know tons of oral surgeons are listening to your podcast. It's growing and growing and making a real difference in the specialty.
Yeah, I was just saying, I've gotten tons of great feedback lately from people texting, calling. Really appreciate our listeners reaching out. Just a week or two ago, I was at a Colorado oral surgery meeting, and multiple attendees came up to me and said, "We love those episodes with Dr. Levin. What great content, and our practices are, changing and enhancing because of the stuff he's sharing." So we really appreciate you talking about that.
Well, honestly, this is why I get out of bed every morning. I love doing this, and I've even spoken to a few people myself that they weren't going to be clients of Levin Group because they don't have practices yet. But if you can help a young person move in the right direction and avoid pitfalls, it's wonderful. It really is. So this has been great. So I'll kick off with you on. We went through a number of strategies in our last podcast. I do encourage everyone to think about re-listening to that periodically, just because the reasons for referral marketing failure probably won't change a lot, but your life situation, your practice situation will change, and you never know what's coming up. I'm actually being interviewed tomorrow for a national journal, and in that journal, they sent me some of the questions. One is, what do I think the future of dentistry is? And one thing I can promise is, well, I won't go into detail now, but it will be changing. So referral marketing is critical because referrals are the lifeblood of an OMS practice. And as we've established in the previous podcasts, if you have enough referrals, you will always be fine. And I would love every oral surgeon going to bed at night knowing that they are in position through their referral marketing to have a good to great stream of referrals, because ultimately you're going to do really well somewhere between really good and phenomenal if you have enough referrals. The only problem you can ever have with enough referrals is if you have a staff or customer service situation where patients are turned off when they come in. So you get the referrals, but then they don't end up accepting treatment. And we don't see that all that often in oral surgery practices, honestly. We see good, we see great, we see exceptional. We don't see too much really bad, mainly because patients would go back to their referring doctors and complain. And as I've said in many seminars, unfortunately or fortunately, referring doctors are not looking to analyze who does the best quality. They want good quality for their patients, certainly, but the main thing they want in the returned patient is two words: no problems. So if you send back problems, I always use the number 3. By the third one, they're looking for a new surgeon to refer to. We don't see that all that often. And we have a whole section in our consulting on what do you do when there is a problem, because you want to take care of that right away. So if you want me to get started, I'll just jump into the strategies for everybody and talk about the reason for failure and then what you can do to avoid it.
Yeah, that'd be great. One quick question on that last point you were bringing up. Because I could think that it would be beneficial for an oral surgeon or a specialist to say to the referring dentist, hey, if you have any issues at all that a patient complains about, I would like you, if possible, to tell me directly, because that, some of those things could get touchy. And if it's like a staff member of the oral surgeon that's causing trouble, maybe that doesn't get back to the oral surgeon, and you want that to get back, right? How do you recommend
Yeah.
guys go about doing that?
I'm going to give you 3 or 4 parts of an answer because that's a really great question, and every surgeon will face it. And one of the most important things is to recognize that normal human psychology can really cause a lot of damage. So you hear from a referring doctor about an unhappy patient, and instead sometimes of solving the problem, I'll come back to that, we get defensive, we get angry. I know of surgeons that have said very unpleasant things to referring doctors in the heat of the moment, but in the end, you lose the referrals, and that's just not worth it. So if you build relationships with referring doctors, and referral marketing is fundamentally about great relationships, there's several things you can do if you maintain your humility. I know I work really hard on staying humble, and it's not easy all the time. We all have human psychology, but if you stay humble and you have humility, you recognize the following. Number one, as a surgeon, you might be highly trained. You have 4 more years than most general dentists of education, but you are dependent on general dentists. And instead of resenting it, embrace it. Understand that you are dependent on GPs, and therefore you want to do everything you can for them. Number two, I'll talk about this again later, you need to support them. So when you're with them, you should be saying things, and I can give you a script like, by the way, if there's ever anything we can do to improve the patient experience from your practice, please let us know. If you ever hear anything from a patient where we can improve our practice, please let me know. That's the humility, being open to being told you can do better. And if you say it, and you say it regularly to your referring doctors in a positive way, they will be comfortable calling you instead of the alternative, which is not calling you and just referring to someone else. So if you have a great relationship, if you're approaching good friendship with your referring doctors, which is what I encourage, if you make it clear that you are open to their feedback and information, then you will be in a great position. And I'll give you an example. Last year, the number 3 referring doctor to an OMS practice, and was considerable revenue, had a patient who came back very unhappy about an implant situation. And the number 3 felt he was a friend of the surgeon, and he called the surgeon, but he got the front desk first. And the front desk person said, well, you can send her back, but we will have to charge her. She just was following a protocol she thought was in place. This is the number 3 referral source. He actually was so angry at lunch, he got in his car, he drove to the oral surgery practice. He went back to a treatment room. Now, this is inappropriate. A patient was being treated, and very annoyed, told the oral surgeon what he thought. Wow. Now, inappropriate on the GP part, but that's not the main point. You never want your GPs unhappy. Keep the door open. Never be defensive. Let them know that you are willing to always work on making the experience better. And by the way, for everybody's knowledge, the future of customer service is the experience. It's not just one hello or goodbye or phone call. It's the total experience, and that's what people want and are expecting. And if you can do that and build relationships, you're going to have a phenomenal set of referrals coming to your practice. Great question, Grant. Thank you.
No problem. All right. Yeah. Sorry to jump off track so quick, but yeah, if we could get to the number 12, that'd be awesome.
Yep, we will. And I love questions. You ask me anything you like, and we could do a whole webinar just on the art of asking questions to develop relationships, because asking questions is great. Okay, so we're going to pick up here with number 12 of why your referral marketing might fail. And it's not offering total support to the referring doctor. You're there to help them. So in the implant arena, for example, there are referring doctors who are still afraid of complex cases. They don't have the confidence as to how to do them. You can't just pick up and send the patient to a prosthodontist without offending the GP. So they don't really diagnose and refer some of these cases. But if you let them know that you're there to help them, you'll bring an implant rep into their practice to help them. You're going to put on courses every year, to update them and advance them in implant dentistry or any other type of procedures, they will greatly appreciate it. Other forms of support. Have you ever sent your referring doctors books, for example? Like right now, there's a book called The Five Types of Wealth by Sahil, Sahil Bloom, Bloom. And I'm just picking this as a random example. This book's getting a lot of press right now in the media. It's good. It's a self-improvement book. It's a don't live only for money book. You know, I've read many of these. It's good. But we have clients now who are giving these books out to their referring dentists. So for a $17 paperback book, and they're giving, and by the way, you want to give a hard copy, not an electronic, so that you can write an inscription, so you can sign it, so you can deliver it, not just have it come from Amazon. Remember, touch points. Use every strategy to touch them as much as you can. And these doctors are going out there and delivering this book themselves. They're not just sending it by their PRC, the professional relations coordinator that I've talked a lot about. They are going themselves and delivering it. And, you know, a book is a low cost, high value opportunity. And one of our doctors went to a referring doctor to drop it off. And he said, well, why don't we get 5 or 10 doctors and we'll do a book club? So now he's setting up a monthly book club where they'll read a certain amount and talk about the book. So it could be any book you like. Make sure it's a positive, life-enhancing book, not War and Peace or something like that. But you know, there are a million things you can do to support them, and a book like that is going to get some dentists very excited about how to live life and give them perspective. So total support. If I were a surgeon, what I would tell my referring doctors, and this would be a huge win, is I am here for you. Let me know anything you need. Those are words I would actually use. And then you have to live up to it. The danger of making statements like that is then you have to actually live up to it. So that's, if you don't offer total support, you will not get the maximum potential of referrals. It may not hurt you, but you will not maximize your referrals. Okay, number 13 is very simply having a small number of referring doctors. Now, I don't mean a small number and small referrals. We have clients who have a small number of referring doctors and huge referrals. And every year we will have calls to panicked level calls for help by surgeons who had 1 or 2 doctors, and they were the big referrers, like over the top, big money, sometimes multiple 6 figures, and something happens. They sell, they leave, there's an issue, and it stops. And that's very dangerous. So if you have huge referring doctors, no, do not get rid of them. Keep them. Don't give them away, but build around it. You want to have a larger referral base. You want a diversified referral base. You want to put 15% of your marketing time and effort into D doctors. Ds do not refer. You want to put your time there. Anytime you get a referral, you get a patient that was not referred to you, that's your chance to go meet and greet and touch that D doctor. So make sure you're always working on building new referral sources and building up some of your smaller referral sources. And another key point there, we talk about A, B, C, and D. I'll come back to that. But C doctors are the ones we hate. And we hate them because they refer just enough each year to remind us that they don't refer to us. You know, it's like the patient comes in, it's like, oh, great, this is the one every 3 months, or the broken tooth they couldn't get out, or the impaction, they can't stop the bleeding. But those C's that you write off and you say, oh, they're horrible and they don't refer to me, and I've heard them called idiots and morons, because anyone who doesn't refer to a certain surgeon must not be very bright, right? But here's the key. And by the way, surgeons, I get the psychology. We all want people to like us and refer to us. The key is those C doctors, many of them, you never did enough to get them to refer. So when we get a new client, we look at the C's, and if we go after 20 C's, no, we're not going to get them all. Nobody's that good. But you might pick up 10 of them, and you might increase referrals from 15 of them. So C's are a very fertile area for surgeons, but a lot of surgeons write them off because you just don't think they like you or they're going to refer to you, and therefore you don't want to deal with them. But it's a mistake because it's a huge opportunity. So number 14 kind of ties back to number 13, loss of a top A. Now, right now, Grant, and this is so important, and I want to warn everybody, a good warning, that there's a trend taking place I don't always know why, but I'm certain at this point it's a trend. It's growing of surgeons who are losing a top referring doctor. And I'm not saying everybody you're going to lose one tomorrow. I'm not trying. I don't do fear. I don't do panic. I do wake up calls. But there are reasons that we never had before. There was no selling to a DSO for a 45-year-old dentist, 15, 20 years ago. But now there is. Retirement. A lot of as you get older, your referral base gets older. The average age of a dentist in this country is 49 years of age. So you're probably going to turn over your referral base at least 1.5 to 2 times in your career, because a lot of your referring doctors are going to age out, or they bring in a young associate. Well, a lot of these young associates, and every surgeon knows this, they're trying to make a living. They're trying to pay back debt. So they start doing a lot of surgery. And by the way, something no one ever told surgeons: general dentists don't learn what not to do in dental school. They learn by making mistakes. Now, most general dentists, by the second or third time they make the same mistake, they'll start referring those patients to the surgeon. There are a few who are going to keep doing everything, and you have to make a decision at some point if you want to keep bailing them out. But bailing out a general dentist the first, second, or third time is a phenomenal marketing strategy, saying to them, if you ever have a problem, just give me a call, because that's how you will keep them referring at least part of their patients to you. Most GPs don't do all the surgery. They'll do some, if they do any. Some do none, some do a little bit, some do a medium amount. Those are all very valuable referral sources to an OMS practice. So again, don't get mad at them for doing a little bit. We have a prosthodontist actually as a client, a real Renaissance man. I like this guy tremendously. And he goes out of his way to teach his referring doctors anything they want to know. He'll teach them how to restore implants. He'll teach them how to place them. But, and he's not the biggest revenue in the country, but he does 2.5 million solo. And I'm not suggesting this is the way everybody should do it, but it works really well for him. And he does a lot of lecturing, and he'll even answer people by email, get on the phone to help them. His whole attitude is helping. It's not a mission. It's not a moral mission for him. It's a ulterior motive. If I help enough people, I'll get enough. And for him, it works. So again, you're going to lose A's, and you want to be building now. As you should go to bed tonight thinking, I'll have one less A tomorrow. Don't panic and don't lay awake. Just put a plan together. What are you going to do to replace that A doctor that might sell out or get sick or retire or move, or one of the many things that can happen today? So those are our first few.
That's really helpful. And I can imagine that would make sense, especially with DSOs buying up so many GP practices and wanting to keep referrals in-house and having their own people they refer to. So having plans and ways to get around that and not having to fall apart every time you lose one of those big referrals would be critical.
Yeah, absolutely. And you don't want to be doing 1 step forward, 1 step backward, or 2 steps forward, 1 step backward. You want to be continuously marketing to referring doctors and not be at all inhibited about the ones who don't refer to you. It's amazing how much they all like attention from oral surgeons. They really appreciate it in a positive way.
Yeah. And I've experienced what you're talking about, how helping out or bailing out, a general dentist who's trying to extract a tooth and can't get the roots out. It is a phenomenal, it's a phenomenal relationship builder just between you and that person, because it can be a very, emotionally charged experience for the patient and the dentist. They're sweating, it's been 4 hours now, they can't get this tooth out. And, if you're able to help solve the problem, it's a eureka moment for that dentist. And, it's just an awesome experience for everyone involved.
Oh, yeah. I have a joke. I hope it comes across. It's funny in seminars anyway. And my joke when I speak to surgeons, I tell them that what they want to tell the general dentist is, when you break the tooth and can't get the root tip out, here's the script. Mrs. Jones, I've done the hard part. I'm going to get you to the oral surgeon to finish this up. And it is a joke because I don't know the percentage. I love data. I can only imagine. But I'm sure over 50% of general dentists have broken a tooth and not gotten out the root tip. Here's the thing. Most general dentists, not all, there are some psychotic people out there, get embarrassed. They're embarrassed that they couldn't finish the procedure. Remember, we're in front of a patient and our patients are awake. So it's embarrassing. And when the surgeon embraces the request, there's no, in fact, you would train your front desk, get that patient in right away. Let's show them we can help them. Let them know. But then don't just send the patient back. That's foolish. You need to talk to that GP and say, hey, no problem. I took care of it. I protected you. Great words. I protected you. Explain to the patient this was a very difficult situation, because they're also worried about being sued. Malpractice is a big trigger for general dentists. This is something that they do worry about. And I'm not sure anybody's going to sue you by having to get a root tip out, but there are other things that happen. So you can really build in crisis moments some of the best relationships people ever have. And then don't make them feel like they're awful for having tried to do it. And just say to them, here are things I can do for you. These are some cases you might want to refer, and I'm here for you. And it's incredible how many GPs eventually, especially young ones, quickly turn off doing procedures that are just not worth it because it doesn't always go well for them. So that your comments were dead on, Grant. I agree. Yeah.
One thing I see repeatedly with these cases, as far as the wording that the general dentist uses, I frequently see a dentist saying to a patient, okay, I got the tooth out, but I need you to go to Dr. Stucki to get it checked, right? And they're trying to avoid saying the words, I could not get the roots out, or I couldn't do, right? And so it's very vague, and a lot of patients show up, they're kind of confused. I'm not sure why I'm here. He just told me to come get it checked. And the patient will say, yeah, so-and-so doctor, they got the tooth out. And then you take an x-ray, and you got these huge hooked roots, and you're like, it's tempting to say, well, they didn't get the tooth out. They just busted the crown off, and now I have to do the hard work.
Yeah.
But I've learned to say, oh yeah, let's check it. Let's just take a quick look. Okay, looks like there's just a little piece there. We got it out. You're all good. And not, but like you're saying, protect and kind of deflect, and not say, oh, geez, now I gotta, suck it up and take the pain of this tooth and all this stuff. He took the glory for taking out the tooth. The patient thinks that, and now, I don't get any credit. That attitude is just self-defeating.
Oh, absolutely. In fact, I have two really important comments. One, let's go back and remember, if you have a relationship with a referring doctor, then they're really going to appreciate you for doing this. And the other key, because we do a lot of scripting at Levin Group in our management program, the word we. You don't call back. You can call up and say, I took care of it for you, or you can say, we are all good. We is a great word, especially in a crisis. We are in this together. We will get it. I mean, what would you say to a friend having a crisis that you're trying to help? We'll attack this together. We will get through this. We will solve it. The worst thing a surgeon can ever do is get mad at a referring doctor. In fact, that is my next reason referral marketing fails, because you're a surgeon who resents referring doctors. And, I'm a positive thinker, but that's also help me to see things not to do. I do look at the positive and the negative of things. I look at the upside and the downside. There is no upside in resenting referring doctors. Even if you're not going to work with them, you need to take an approach of being positive. You need to release them as nicely as you can. In our company, we have something called the Prime Directive that I learned from Jim Collins. And the Prime Directive, which is a play on Star Wars, says, in any situation, leave it in the best relationship you possibly can. Just because you're not going to work with somebody doesn't give you open season to, tell them off or shoot at them or let your anger come out. Always leave a staff member, even if you're terminating someone, leave every situation the best way you can. I promise everyone listening, you will have a better life. But when it comes to referrals, resenting referring doctors is the wrong emotion, because it's going to come out. You're either not going to make the call, you're not going to send the text, you're not going to every time you touch them, you're not going to compliment them and thank them and appreciate them. and let them know, how much you appreciate their referrals. So that's the next reason for referral marketing failure, is resenting your referring doctors. And surgeons, I understand oral surgeons, nobody likes being dependent, but you are. So work with it. Don't work against it, would be my statement to everyone.
Yeah, love that. That's a great point.
Okay, the next one is kind of an offshoot here. It's not, the other ones don't lead to this, is social media. Now, social media is a fascinating animal. It can work really well. It can totally fail 100% and cost a lot of money, or it can work for a while and then not work when Google changes all the algorithms. But here's the thing. There's a great desire to just do social media and not do referral marketing with your referring doctors. It's a huge, huge mistake. First of all, most oral surgery referrals come from general dentists, the vast majority. Secondly, it's what I call the lazy factor. Instead of me going out there as a surgeon and meeting and greeting and lunching and happy houring and dropping off and stopping by and giving out a book or whatever it may be, I'll just write a check and that company will do social media for me. Be careful. It's not a guaranteed strategy. It often will not work properly. There are ad firms that will sell you social media. They'll tell you it's the only way to go. And the worst part is they tell you they have the only secret that makes social media work for oral surgeons in the country. Now, by the way, I know a lot about social media. I have people in my company that know a lot more. We don't do it for our clients. We'll give them ideas, but we don't do the social media. But having said that, I can tell you that everybody knows every secret. Anybody in tech knows the same thing. It's all available. There are no secrets. And why it works in some areas versus others has more to do with demographics. How long it works has more to do with Google algorithms. And ultimately, social media, if you're using it, should be a small part of your referral marketing. I'm sure there are exceptions out there. And, Grant, you might get a letter from somebody who says, well, I get 95% of my referrals from social media. If you're out there, I congratulate you. It's great. I love success. But for the most part, it is not the smart strategy going forward. I'm not saying don't have any, but don't hang your hat on it and stop working with your referring doctors. They really are the key to your success. So the next one, Grant's kind of fun. And now this one has a wide variability. I want to tell everybody that up front. But Levin Group recommends a 60-30-10 model, and we call it the 60-30-10 model. And what does that mean? A, B, C, D. A's are your best referral sources. B's are good referral sources. C's are low-level referral sources. And D's generally don't refer to you at all, with an occasional exception. By the way, if you're getting referrals from C's and D's, it's often because they're sick of sending their mistakes to their own surgeon. They're embarrassed, so they'll send it to you. And you can still use that to try to build a relationship. So 60-30-10. We recommend, and there's a wide range here, about 60% of your referrals come from your A's, 30% come from your B's, and 10% come from your C's. Now, if you really want to challenge me in this podcast, and I think it's great, you might say, wait a minute, Roger, you said earlier that you could get C's to refer more. And the answer is yes. So why are they still at 10%? Because when they refer more, they become A's and B's. So C's will always be those low-level referral sources. Once they turn on, or we turn them on, they become an A or a B by category. And you should be analyzing your referral base every month, A's, B's, C's, and D's, how many referrals and how much production from each referral source, because those two lists don't always prioritize the same way. You can have a referral source that sends a lot of referrals, but they don't accept treatment. So their production would be low, and vice versa. You might have a referral source that only sends you mega cases, not a lot of them, but enough to really, be positive in terms of practice revenue. And these lists, and we use Excel spreadsheets every month to analyze client referrals. These lists are very revealing, and you should definitely prioritize your referral sources and separately their production to see who's referring, who's sending production. Are there any trends or changes? So whether it's a 70-20 model, whether it is a 50-40, 10 model, etc., that's fine. But 60-30-10 is something to start with just for comparison to look at for your referral base.
I like that a lot. One question is just, because you bring up the kind of like quantity versus quality of referral, at least quality from like a financial standpoint. And I would think a lot of that could be improved. The production slash quality of it could be improved with communicating and saying, hey, for example, with every type of extraction that's like this, our office would recommend bone graft or, with platelet therapy in a membrane, or coaching them to know how to talk to the patient to, do these cases properly, but also at a kind of a higher production level. I mean, any comments about that conversation?
Yeah, it comes back to education and when we build referral marketing annual calendars, we build it in categories. There's personal, there's professional, there's education, there is different types of services. So, for example, I encourage the surgeons on this call to hold dinners. General dentists really don't want to take a lot of time out of their practice. They're more afraid of losing production than ever before. In one of our upcoming podcasts, Grant, we might do know your numbers, but I can also share information about the general practices, because you should also know your customers. And holding a dinner periodically instead of during the day, and giving a lecture, and by the way, keep it short. Nobody wants long anymore. People are trained now short. They go on YouTube, they want 3 minutes. So keep your lectures, 40 minutes, 45 minutes. Everything doesn't have to be an hour. And the surgeons can give these lectures. And one of the things you should educate them is, when we do an implant case, we may want to do a bone graft. We may want to do other procedures along with the implant case. And here's why we do it. And here's how it works. And we don't really want them educating their patients about it as much as not being surprised when a patient comes back and there's several additional parts to the treatment versus what they thought they were referring. So it's the surgeon's job to educate these referring doctors, whether it's an evening seminar at a restaurant. Oh, by the way, everybody's going to laugh at me, but it's definitely true. The better the restaurant, the better the attendance. It's absolutely, it's true. We've seen it forever. Good restaurants, good steakhouses, you'll get better attendance. So you can educate them that way. You can do it one-on-one. We love lunch and learns. A lot of general dentists don't want to go out for lunch anymore. It used to be, that the surgeon had to run out, go to lunch, run back, very stressful. Now we schedule an hour. You go into their office. The PRC, the professional relations coordinator, sets all of this up. You bring in lunch. You do a 25-minute laptop presentation. And again, you rotate through referring doctors and you educate them about procedures, about advances, about why you do additional procedures related to the primary treatment. And if you're not educating them, no one else is going to do it for you. So it's really important. We have Glidewell Dental Laboratories is the largest dental lab in the world. I've known Jim Glidewell for 40 years. He's built, they have 5,500 employees out in Newport Beach, California. It's an incredible setup, robotics. It's incredible. Why am I mentioning them? We have surgeons that will take general dentists, 2 or 3 or 4 general dentists to one of their symposiums. They have implant symposiums with 5, 6, 7 top speakers. And most of and the general dentist could learn how to place implants, but really it's academic, not hands-on. And the reality is most of them come out better educated about implants, implant procedures, and become better referral sources. Now, that's not an inexpensive strategy, but also what's the other benefit? You spend 2 days with referring doctors and you do it right, you've got them for life. I mean, it's you've gone above and beyond. And I'm not suggesting to everyone listening that that's the strategy for you. It's not inexpensive. You can have a whole set of inexpensive strategies that work well, but you can also, as you get more successful, allocate some dollars toward more expensive strategies and the positive effect that they will have. So I don't want anyone to think I'm saying, oh, that's the only way to go, because that's, it's costly. But on the other hand, what's the return on investment for the next 5, 10, 15, 20 years of doing something like that? And that's just one of hundreds of strategies people can pick from going forward.
I like that a lot. I do a periodic meeting with all of my referring docs and usually their managers as well. And I try to keep it to 20 to 30 minute or less PowerPoint. And I think one thing that helps me a lot, and most surgeons and specialists are kind of fearful to streamline things down and make, I guess you could say, rules, but I feel like our referring doctors, they kind of need really basic like rules, like, and say, whatever, 99% of the time, here's how we're going to do it. We're going to, if it's a number 30, we're going to extract it and bone graft it. We're going to do PRF with that. We're going to put a membrane. We're going to suture it. We're going to wait 3 months. We're going to do the implant. We're going to wait 4 months. Like, and I know there's always, and we're hesitant to say that as a specialist because that it's not always that way, right? There's variations and there's nuances. But I feel like if you do too many caveats and there's too much complexity to what you're telling your referring docs, it can all get lost, in the mix. And you want something simple, especially for a manager, a front desk person at the other office to understand, so that it's very much like, oh, I know exactly how Dr. Stucki is going to do this. Boom, boom, boom. It's all super smooth. And maybe the end caveat is, so this is how he usually does it, but just so you know, there may be some, nuances or changes, but here's how we're going to plan it, and Dr. Stucki can vary this as needed. I don't know. What are your thoughts on that one?
Oh, I think we could spend the next hour just on what you just said. I mean, it is, first of all, I want to just highlight the word simple. Simple wins. There's a mantra for everyone to learn. Simple wins. Make it easy for the customer to do business with you. And I've said forever, whoever makes it easiest wins. It's one of my favorite business statements, specialist statements, surgeon statements. Whoever makes it easiest wins. And what you just described is brilliant. Give them the categories. Here's what will happen 90% of the time. That's what you said. That is a beautiful statement. That, because there are 2 words I learned from a huge entrepreneur years ago that have stuck with me for the last 35 years. Manage expectations. The GP doesn't want to know every detail of how you do it, but they want to know what to expect. They want to know what it means when a patient comes back and asks questions. And they do. They all come back. They got a question or a comment, and they don't want to be caught off guard. So if they say, oh, it's going to be 4 months before the implant can be placed, or for healing or whatever it may be, some GPs like, well, wait a minute, why that? Instead of saying, exactly, but when it's done, you're going to have an implant that's better than your natural tooth and might last you the rest of your life. Right. So I love what you said, Grant. Again, simple wins, but categorize things and manage expectations. Never tell a GP you're going to do something and then not do it. That's would be another version of referral marketing failure in that regard. So that's great. Really, really good there. Okay, so the next one would be what I call not following up with D doctors. I think one of the biggest mistakes, and I have to admit, to me, it's common sense. But as somebody once said to me when I made that comment, they said, well, your common sense and mine are not the same. But my common sense says if you get a referral from a D doctor, or even worse, they send you one of their children, and all you do is treat and refer back, I know you've missed a huge opportunity. Whenever you get a referral from a non-referring doctor, you note that right away. You should know in the morning meeting that someone's coming in that does not fit a normal referral pattern, and you should act immediately to get in touch with that referring doctor, to try to get together with that referring doctor, to send something over to that referring doctor. And by the way, for everybody who feels inhibited or embarrassed, as if, gee, are they going to wonder if I'm desperate? I've heard that over the years. The answer is no. It's amazing. And we've worked with, thousands of specialty practices and literally close to 5,000 OMS practices in 40 years, or OMS doctors. I can tell you GPs love the attention. It's positive. If you just come out of nowhere and start being really nice and being present and they're seeing you and hearing from you, they don't say, what's going on here? They like it. And they, of course, they know you want referrals. Nobody's uninformed about that, but they don't mind because they love the attention. And if you pay more attention to them than their current referral source, you will end up getting a lot of those referrals, if not all, coming to you. So whenever a D refers, take note. Don't just send back and think, oh, they'll see how good I am, they're going to send me everything, because I guarantee you that's not going to happen. The next one, and we're on number 19 now. So I put a lot together. I thought of number 26, by the way, while we're sitting here, of my 25. But number 19 is, I call it not throwing out a net. I think one huge mistake is the surgical practice will try to get a specific GP practice to refer. Now, there's nothing wrong with that. But Grant, if you called me as an oral surgeon and I run a consulting firm and said, Roger, I want to enroll in your referral marketing consulting program, and I'm going to pay you triple your normal fees, but you have to get me Joe Smith referring to my practice. I have to walk away because I don't know that I can do that out of full integrity, full court press, everything we know how to do. Can't guarantee I can get you Joe Smith. However, if you chase 10 non-referring doctors, you're going to pick up on average 2 or 3 gradually, not overnight. I always tell people our own program, which is very scientific and data driven, takes 5 or 6 months before you start seeing results. This is not a gimmick program. Most gimmicks run out pretty quickly. Most clever runs out pretty quickly. So you build relationships. It takes time, and you throw out a net. So you don't just chase a couple of practices or market to them thinking, oh, if I get them, I've got it made. That may be a true statement, but you may not get them. So you have to go broad. You throw out a net and see what you actually capture. That's the best approach to referral marketing. You can't target it like a sniper trying to just pick up one specific practice because there may be a reason that they don't refer to you ever. And it may not be bad. We get all these paranoia thoughts of they don't like me, or why don't they refer to me, or they're not very smart. But in reality, there may be a lot of reasons that they like the referral source they're working with. If they have a great referral source who's paying a lot of attention to them, you're going to have trouble taking them away. Fortunately, most practices have lulls in their marketing over time, which creates opportunities to bring in some of those doctors to you.
I like that. Cast a broad net. Yeah, really important point.
Yeah. Okay. So number 20 is relying heavily on study clubs. Because we do so much education, and I love educating, and I want everyone listening to know that this is a great pleasure for me. I hold nothing back, but we get a lot of calls and emails and text messages just asking for advice. And one of the routine questions is, should I launch a study club? Or in the interview I mentioned earlier, one of the questions was, should I join study clubs as a specialist? That happened to be an orthodontic interview. We're multi-divisional, but the Journal of Clinical Orthodontics is interviewing me on referral marketing. And the reality is that study clubs were an incredible marketing strategy in the 80s, 90s, and early 2000s. They're still good, but they're hit or miss also now. Your younger doctors don't want to go out. They don't join. They want everything online. And after the study club has gone on for a while, you're maintaining relationships, but you're not increasing the number of referrals. So if you're going to launch a study club, it is a lot of work. It's fine to do it, but it is one strategy. And if everyone remembers, if you heard my last podcast with Grant, I mentioned that you need quantity of strategies, and the quantity was 15. That's a real number. We've studied it. Now, it might be 14, it might be 16. We don't want to break it down like that, but it's not 5 strategies, and you don't need 25 strategies. So if you have a study club, that's one strategy. There's a national organization, they have study clubs. They can be great, or they can falter, or they cannot be so great. And again, use the study club when you're there to set up your next contacts, to build more relations. Because study clubs are great for education, they're great for touching people, but they're not an entire marketing strategy. And going to study clubs can be good. There are two types. The first type, you're not the only oral surgeon there. So everybody's walking around shaking hands, and it's pretty much a waste of your time, like local society meetings. And I think you need to go. Don't misunderstand me, because not going is omission, but you're not going to pick up lots of referrals by going to the local dental society meeting and shaking hands. On the other hand, if you're the only surgeon in a study club and you're the expert resource in that club for education and knowledge about oral surgery, that can be a very positive thing. But it's still only one strategy, and it's a high work strategy. So you feel like, oh, I'm doing so much, this should be like all I need to do, or one of three things. That is definitely not the case going forward. So study clubs are fine, but you cannot rely on them today as the only approach you take toward referral marketing. So that's a mistake that we see quite often. Number 21, I mentioned earlier, this is the big one, might be the biggest one. It kills relationships, sending problems back to a GP. Our rule at Levin Group is very simple. If you even perceive the slightest patient problem, the surgeon, not a staff member, the surgeon should get to the GP first. You may be embarrassed. You may be defensive. Forget all that. This isn't even about humility. This is about survival. Any problems that go back to GPs are potential lost referral sources. And sometimes it just takes one. I've had lots of surgeons say to me, I took care of that guy in his practice and for years, and anything they needed, and bailed them out. And we had one problem and they cut me off. Well, life isn't fair, everybody. And human psychology isn't fair. And maybe the GP is afraid they're going to get sued. Maybe the GP is embarrassed from that patient. Maybe the whole family pulled out of the practice. Whatever it is, your best chance for success if there's a problem, and everybody has problems, is get to the GP first. Last year, we had a huge problem that occurred in an oral surgery practice. And they waited 7 days to call the general dentist before we even heard about it. And actually, the consultant called me after the consultant learned about it and said, I just want to check things. What do you think I should do? I said, I think I should personally call the surgeon. It was a very sensitive issue. I called the surgeon and said, you've got to get to the GP today. Here's the scripting you need to use. Whatever's going to happen, you should have been there. When I say should, I don't make it sound like you should have been there 7 days ago, but they should have been there 7 days ago from a referral marketing standpoint. And again, I'm always positive. He called the GP thinking this is just really going to be bad. And what did the GP say? Oh, yeah, I heard from her. She's the worst patient in my practice. She's really mad. She's leaving the practice, and I couldn't be more delighted. It's just one of those rare stories that works out very differently than you expect. But either way, they still should have called 7 days earlier and been right there to support the GP from the beginning.
Yeah, I totally agree. I have learned that over the years, that if there are problems, just to go as soon as possible to my referring doc and chat it out, say, here's what's going on, because it's never a good strategy to think, oh, maybe no one, they'll never, it won't get back to the GP. They'll never realize it. Let's just sweep it under the rug.
Right.
It's always going to come out at some point, and the GP will always feel like an idiot if they haven't been given a heads up. It's much smoother if you've given them all the info. Hey, let's attack this together, and you're working as a team. And sure, it still may cause problems for the GP, but at least they're armed and ready for the situation.
And I'm going to give you part two of that one, Grant, which is we meet surgeons where there is a problem and they're fretting over, well, should I charge half to replace the implant? Or how much should I charge? Or should I give them their money back? And it's like, come on, you're not going to retire one day later by giving up on this case. It's like this moral position of I have a right to kill it. If there's a problem, you want to kill it. And the best way to kill it is don't play games, don't negotiate. Ask this question: what is the maximum I can do to solve this problem? We had an A doctor many years with an oral surgeon last year. Patient was furious about an implant case. Patient wanted their money back from the GP. The surgeon's a smart surgeon. The GP called and said, hey, I got this problem. Can you call and talk to the patient? The surgeon said, of course I can. Called the patient, said, we'll refund all of your money I'll be happy to replace the implant. If you want to go somewhere else, I'll pay for your implant. Now you might say, "Oh my God, that's ridiculous. It wasn't that bad. He has no reason to have to do that." Every surgeon listening has at least 1 millisecond where they said to themselves, "I wouldn't want to do that." And I don't blame you, but do it anyway because you want to kill a problem. Believe me, $3,000, $4,000, $5,000, you won't retire one day later. But if you lose that referral source, you might retire 6 or 12 months later. So always go for the greater good and the smart play. When there's a problem, end it any way you possibly can to take the heat off of your referring doctor, because they're going to keep referring, and that's worth its weight in gold. There's no one patient worth losing a referral source over.
For sure. And
Yeah.
also medical legally. I mean, we've talked about this on the podcast, but that's just the best way to avoid medical legal problems is to refund, apologize, do everything you possibly can, document that, show you're bending over backwards to help this patient. You don't want to go halfway and kind of in and out, and you just got to go for it and get the problem done.
Yeah, it makes it even worse, actually, when you start negotiating. Like you're trying to be nice, and you're making it worse. Just kill it. So along those lines, number 22, a little bit different, is ignoring the referring doctor staff. They are so powerful. And I could do a whole webinar just on hygienists, one of our marketing strategies. And whenever I say one of our marketing strategies, it's not for everybody. Everybody doesn't do it. I don't know, maybe the one I'm going to tell you now, maybe 20% do, 15%. We pick and choose for each client. You should pick and choose the ones each of you listening feel are best for you. But hygiene study clubs, we have surgeons who, periodontists do it a lot. There's a more natural overlap there, but we have surgeons that run hygiene study clubs, and they love to get together once a quarter, and you buy the food, you buy the drinks, but they refer a lot. Or just once or twice a year, a hygiene only seminar in the evening. And we have a client who recently, he just got over 80 hygienists that showed up for an evening meeting. If you get 20, if you get 30, if you get 15, it's worth its weight in gold, because they can diagnose and talk to patients on behalf of the GPs, so to speak. I know it's illegal for hygienists to diagnose, but they are very good at identifying what needs to be done, motivating a patient about an implant. But I want to go broader. Do not ignore the entire referring doctor staff. They're generally not all that, they don't feel they're all that appreciated. It's not that GPs aren't nice. They really are. They're very nice. But they don't always go out of their way to wow their staff. They don't think of their staff as a customer. I think of our consultants as one of my biggest customers. And Grant, you should think of your team as a customer. And what's the customer service plan for the team? Well, when you come in, whether it's food or gifts or lotteries or gift certificates or anything you do for the referring doctor staff, they love it and they love you. And surgeons, get into those practices periodically and say hello. They say things like, "Oh, now I know what you look like," or I saw you on the website, and you're here. You're like a little celebrity sometimes walking in. Go out of your way to wow and appreciate the referring doctor staff. It doesn't have to be expensive. And your PRC, by the way, is a liaison to that staff. Part of her job is building relationships with the referring practice staff. She learns to say things like, "Is there anything that we can do to make it easier for you to refer to us?" Or if there's ever anything we can do to improve your patient experience, please let us know. I mean, words like that, you don't hear that from many people, and it's a wow. It's a real wow. It's a big win. And then they start talking to the referring doctors about how nice you are. And they also get questions about you when they're referred to you when they come up to the front desk. 4 out of 5 patients will ask about your oral surgery practice at the front desk after someone referred them in the clinical area.
Oh yeah, absolutely love this point, because I feel like you're saying, most of the information the patients are getting about your office, about you, about the way you do things isn't from the GP. It's usually from the people, the front desk staff, the assistants who's helping the GP. Usually, if you're lucky, a GP will say, "Oh yeah, the Dr. Stucki's good," but generally it's just, "Okay, go see our surgeon." There's not much, verbiage from the doctor themselves.
Yeah, exactly. You want great endorsement from the GP practice, which takes me to my number 23, which is a huge mistake, not endorsing the general dentist. This needs to be a ritual, just like brushing your teeth. Automatic, absolutely automatic. Whenever you talk to a patient, the first let me go back a minute. When the patient calls the OMS practice on the phone after you ask who may we thank for referring you, you should, if they mention a general dentist, the immediate response is, oh, Dr. Jones, he is a great dentist, or Dr. Jones Smith, she is a great dentist. Just say that. I don't care if you don't get to not like your referring doctors. You need to like them. If they refer to you, you need to like them. In a human world, you can say, oh, I don't like that doctor's personality. This is the referral marketing world. This is my universe. And in my universe, you need to like your referring doctors. And in liking them, you say things like, she is a great dentist. Now, surgeons sometimes get their back up. They'll say, well, what if they're not a great dentist? Seriously? That's we're not a court of law. We're not the International Criminal Court here. We're trying to increase referrals. When you meet a patient as a surgeon, you say to them, oh, you're a patient of Dr. Smith. He is a great dentist. You don't say, I can't say that because they're really not a great dentist. I mean, let's get with the program here, everybody. Take yourself into my universe. If they refer to you and you accept their patients, they're all great dentists, and great something because they're referring to you. So Grant, you're
Yes.
laughing. You're laughing as we are doing this one.
Oh, yes. No, this is a great point. I think some of us need practice at this because, I don't know. I guess there's that feeling that you got to tell the truth at all times, and it's, you want your word to be valuable, so you can't call everybody great. You can only call one or two people great.
Right.
But no, I try to do this at all times. Any opportunity I can. Oh my gosh, yeah, I love Dr. Smith. So great. What a tremendous doctor. You're so lucky to be going to him. That's so
Yep.
great. Stuff like that is always helpful.
Yeah, in OMS lectures, on referral marketing. I also lecture on management, but in referral marketing, I use the analogy that you should pretend that every patient walks in wearing a sign on their forehead that says, what do you want me to tell my general dentist when I go back? Because they're going to comment. Don't ever lose sight of that. They are going to make a comment when they go back about you. They were great. They were terrific. That's what you hear a lot of the time, most of the time. You don't want to hear, I didn't get treated well, or the front desk wasn't nice, or I had to wait endlessly for an appointment, or these sort of things. I always talk, Grant, about there are two types of honesty. The type I'm very honest about is what I say. I try to say things that I generally believe. But the type I don't always follow is what I don't say. I don't feel the need to always say what's in my head that nobody wants to hear. Like, that's a really ugly shirt, right? Nobody needs you to tell them that you think their dentist is not great, or not bother saying you have a great dentist because you're unhappy with them and you think they could be better dentists. So I strongly recommend endorsing the GP every single time. Number 24, we're coming down to the end, is my number one reason for referral marketing failure. Maybe I should have saved that till number 25, but the number one reason in my top list of reasons for referral marketing failure is inconsistency. And what I started writing about literally 2 months ago, because we're seeing this loss of a top referring doctor trend taking place, is the word continuous. You need your referral marketing to be continuous. Now, for the last 40 years, I'd say about 38 of them, maybe 37, we had many practices join us. They had stopped referral marketing. They hadn't done it in years. We brought it right back. We built it up. No problem. By 5 months, they were growing right on schedule. Personally, I think that's going to get harder. I think the bigger the gaps in your referral marketing, the more inconsistencies, it's going to take longer to bring you back if you decline or if you're flat. So the word is now continuous. I'm going to really start prioritizing the message that you need referral marketing to be continuous. And that's why you need a PRC, and you need a highly trained PRC, because she's going to carry out 95% of the program. When the surgeon's away, she continues. When the surgeon's sick, she continues. When the surgeon's distracted, she continues. And that's absolutely critical, the word continuous, and you don't want inconsistency.
Love it. Yeah. What a great point.
Yeah.
Very powerful.
All right, here's my last one, and I probably should have made inconsistency my last one. I'll know for the future. A single rude response. I alluded to this earlier. We are all human. We all have bad days, bad moods, bad moments, and say really stupid things that we'd like to take back. Don't do it with a referring doctor. I don't care how bad your day is. I don't care how mad you are at them. I don't care how much you think they're doing something wrong, short of committing malpractice or something illegal. Do not ever give a rude response. Just make it illegal in your life. It's illegal. Like you're in a court of law and you're being tried for a criminal case. You are not going to say anything abusive to the judge, most likely, right? Because that's who's going to sentence you. Do not ever make a rude comment to referring doctors. And by the way, another mistake, and we've seen this a few times, and there was a cost. Don't talk about other general dentists poorly to a general dentist. You never know who's a friend. And by the way, they love to repeat things like that. Everybody's human, not just it's human nature. They hear something. Do you know what so and so said about you? Don't make any rude comments ever to or about referring doctors or general dentists in your community, and make that a law. If I was going to do a webinar or a podcast called the 10 Laws of Referral Marketing, this would definitely be one of my laws. Don't ever do it. And think about it, because what happens is you don't think about it. One day it just happens. Well, then you're going to think about it because you'll have lost referral sources. This list, and here's a point I really want to make. There are two ways to really increase your revenue and production. The professional relations coordinator that I've talked a lot about, having them in the right number of hours, will give you an $8 to $10 million return over 20 years. This is data. This is not my opinion. This is data. It is an incredible return on investment. Not committing the 25 reasons for referral marketing failure, I can't begin to put a number on it, but it could be 30 million. There's no way to know how huge it is that if you avoid these mistakes, you will be so much more successful. And Grant, I may have mentioned, I personally have 6 clients, several oral surgeons. Everyone in my company has to have clients. It keeps us grounded, keeps us aware, keeps us knowing exactly what's going on. Mine are not referral marketing or management, they're executive coaching. So I have 6 highly successful doctors. That's my sweet spot, that want more success. But don't think badly of them. They also have to be amongst the nicest people in the world, because I do this for fun. And what I always tell them, my job is twofold: to help them achieve their goals and to protect them. And I take that job very, very seriously. And if I've had conversations with some of my clients that want to cut off a referral source, which is fine, but we talk about how to do it. The prime directive: do it in a way that is not going to create serious problems or have someone hate you or want to get back at you or badmouth you down the road. So these are the 25 in the last podcast and this one. By the way, these are great for your staff to hear, because it's the front desk person who can be rude and kill a referral source. We've heard about this from general dentists for 40 years. I'm not referring to them anymore, because it's hard to accept this, but a general dentist would rather lose an oral surgeon than a front desk person. You're easier to replace. I hate to say it. So, right, especially today. So these are the 25 grand. I hope we've helped a lot of people with these. I hope they're useful. I hope I've given a lot of good recommendations, and I've loved doing this with you.
Yeah, these have been powerful points, and each one has just been awesome. My one comment on the last one, 25, no rude response. I would guess that most of the bad behavior and rude sayings and things happen when you're talking to maybe a C or a D referral source, or let's say you're a surgeon who works in the itinerant setting, or maybe you're in a DSO and you kind of feel like, you have the power there, and they can't kick you out or stuff like that. I think there's some abuse there when you feel like maybe you have some type of leverage, or you're thinking, who cares about this C referral? I'd be happy if I lost them, so I'm gonna let
Yep.
loose and lash out at them. But I feel like no good comes from that. Like you're saying, people talk. It could get back to a B or an A. It's just, you got to be careful with every single person you're talking to.
I couldn't agree more. And I'm thinking now about a surgeon I talked to, 6 months ago, who did exactly that. He's on vacation. He gets a cell phone call from a C minus 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 to send a patient that he had started the case. There are all kinds of problems. And he said, I'm quoting, you always send me crap. I'm not going to see your patient, and I don't want to see any more of your patients. And then he hung up the phone. He thought about it, and he called me from vacation and said, here's what I just did. He's a client of ours, and he has a consultant, but he thought, I better run this up the ladder to Roger immediately. And he's like, okay, here's what I did. Here's what I said. What should I do now? And by the way, the guy's never going to be a good referral source. He does all his own surgery. He's done it for years. He's not going to change.
Yeah.
But that's still not a reason to go out of your way to really lay into somebody verbally and demean them, because no matter who you're talking to, they think they're right. They'll never think you're right. They think they're right, and they will dislike you and resent you for the rest of their career. And they're in your community. Because if they weren't in your community, you wouldn't care that they don't refer to you. So it's really, really important to train yourself never, ever demean a referring doctor, and never, ever demean one referring doctor to another. Not a good idea. I'll end with one thought for you if we have a second. I don't want to go deep on this, but the newest area we're adding into our consulting, and I'm telling the listeners, I never solicit when I'm educating. I'm telling you these things so you can go do them, is how do you deal with DSOs? Because a lot of times the dentists change every 6 or 12 months, and it's different. But DSOs can still be a really great opportunity for referrals, but it's a different kind of relationship building. And one of the key points we've hit on is also build great relationships with the office managers, even more so than with your private practice referral base, because the office manager will be there and will be the one who's introducing you to the new doctor. But you got to be in touch with them, because you don't want to find out 12 months later the doctor who was referring to you left. You don't even look at your referral sources and where they come from. And now a year later, somebody else has been there and you haven't even bothered to meet them and greet them. It's a different kind of marketing, but it's going to be part of referral marketing, and it can be very lucrative as well.
Awesome. Love it. Well, good. I'm glad you guys are doing so many good things, and you're always trying to coach and in any setting a surgeon or a specialist or a dentist might be in. And thank you again for sharing this content. It's been awesome. Thanks to our listeners for listening. If you have any feedback, please text or email or call. But yes, I look forward to doing some more episodes with you, Roger. It's always a pleasure.
Oh, this is it's absolutely great, and I'm delighted and look forward to more in the future.
All right. Thank you so much. Have a good rest of your day. Thank you so much for listening to this episode of Everyday Oral Surgery. For more information on these podcasts, please visit everydayoralsurgery.com. I love feedback and would be very grateful if you would reach out to me via my email, grantstucki@gmail.com, and let me know what you thought of this episode. Or you can text me at 720-441-6059. Additionally, if you have any topics you'd like to hear about, or if you would like to be a guest on the podcast, please email or text me. I found many of my interviewees through people who have been contacting me and have been listening, and I've gotten so many great ideas for more podcasts, and that's what helps keep the podcast rolling. So I really appreciate you making that extra effort and helping me out with feedback and knowing what to do next on the podcast. Thank you so much.